Okay, good day to you, and welcome to today's section. My name is Dr. Aliu, and today we're going to be looking at non-conforming event management, part of our quality management system training. My name is Dr. Aliu, QMS consultant with Pegasus Consultancy. So please, if you have any question, please feel free to put your question on the comment section, or after the class, you can take your question. Please ensure you mute your mic.
Thomas they are not.
Please do well to mute your mic, please, as we continue. So we're going to be looking at non-conforming event management today. So the learning objectives at the end of this module, you should be able to develop non-conforming event management policies, procedures, and forms. Next, define in terms the term non-conformity as NC. You should be able to identify non-conformity and the causes in your organization or your lab, as it could be. That you should be able to perform root cause analysis and differentiate between preventive actions and corrective actions at the end of the day. So, just a little recap for those of us, depending on the session you are, on the quality management system training session you are. So, we have the 12 quality system essentials, which have already been established over the period of time. We have organization, personnel, equipment, purchase and inventory, process management, information management, document and record, non-conforming event management. We have assessment, we have continual improvement, we have facility and safety. They will also have customers focus. Okay, so today we're going to be looking at non-conforming event management as part of the 12 quality system essentials, which we are going to be discussing today. So if you are just joining us, my name is Dr. Aliu from Pegasus Consultancy. So when we talk about non-conformity, which is also known as NC, what is non-conformity? So according to the ISO 15192 standard requirement, defines non-conformity as a non-fulfillment of a requirement. So any act of not fulfilling a particular requirement is known as what? Non-conformance. So if there's a particular requirement, particular standard, when you don't fulfill that requirement, it's known as what? A non-conformity. So occurrence is an event. It can be an accident, could be a circumstances, could be anything that happened without intention or without a plan. So that is an occurrence. So any event that happened without an intent, without a plan, is known as what? Occurrence. So that's one of the difference between non-conformity and occurrence. So occurrence is an event, could be a circumstances, could be an action, anything that happened without an intent, with violation or with plan, is known as what? Occurrence. Why non-conformity is non-fulfilling or non-fulfillment of a particular requirement. Now, when we talk about NC's identification, now we should be able to understand that non-conformance management is one of a great tool for us to improve our processes, improve what we do, improve our organization. So it is not a punitive measure. It is not an act of trying to body some employee or increase your work within the lab space, but it's a tool for us to be able to improve our system, be able to ensure that things are identified, uh, any form of non-conformities are addressed and properly managed, so that at the end of the day, the patient, the client can have a good services, a good quality healthcare services that is being provided. So this is one of a great tool. So it's something that most labs or most organizations that are growing that have not fully implemented quality management systems, one of the shortfalls or the things that some people find it difficult or some people don't actually want to do. So NC identification, so first and foremost, there's an occurrence. If there is an occurrence, you has a requirement been violated, has the standard been violated, has a procedure been violated. If no, you document the occurrence as what? As part the procedure. But if that has violated any of the standard, any of the procedure, then it's expected that what you treat it as what a non-conform. So you document the non-conformance. At the end of the day, you put the corrective actions to it. So the whole act of identifying it, putting an action to be able to address the non-conformity is known as the non-conformity management. So that's what we are going to be looking. So what are the elements of the non-conformity management? How can you manage a non-conformity within your organization, within your facility? Number one, you need to develop policies, procedures, processes, and form for non-conformance. So the organization needs to have a policy. What's the policy of non-conformance, non-conformity? Then what are the procedures? How is a non-conformity? Ensure you mute your mic, please. How are those non-conformity being done? What are the processes? What are the forms that are used to help to manage what those non-conformities? So it's important first the organization have a policy for non-conformity. Next, have a procedure. It could be an SOP, it could be a chart on what to do when there is a non-conformity. Then what are the processes? Then what are the forms that we can use to be able to handle our non-conformers? And those forms, when they are now filled and treated, it now becomes what a record. So we need to see the policy, we need to see the procedures, we need to see the forms, and we need to see the compliance, which is the evidence of managing that non-conformity, which is what the non-conformity records. Next, identification of the non-conformity. So you have to identify the non-conformity. Non-conformity can be divided into two. We have major non-conformance and minor non-conformance. Now, when a requirement, when there's a violation, and that violation has to do can affect the patient management or the patient care directly, it is a major non-conformance. When it has to do with safety issues, it's a major non-conformance. Or when there is a non-fulfillment of that particular standard at all, it's a major non-conformance. So you get it. A major non-conformance has to do with a conformance that can directly affect the patient care. Let's say, for example, now you are to run a quality control before releasing your patient result, and you fail to do it, or the quality control did not pass, and you release the result. Does that action have a direct effect on the patient result? Yes, it does. Does it have a direct effect on the patient management? Yes, it does. So such non-conformance or non-fulfillment of that requirement is a major non-conformance. The non-conformity has to do with safety of personnel, safety of the patient. It's also what a major non-conformance. And when there is a non-fulfillment of a particular requirement at all, it's a particular requirement and the organization is not fulfilling it at all, there is no procedure, nothing for it. It's also known as what a major non-conformance. Then next, we evaluate the impact of the non-conformance. What evaluate the significant impact of the non-conformance. Then you take actions, take the immediate actions. The immediate action is what you do to mitigate the effect of that non-conformity at that particular period of time. Let's say, for example, now if a patient comes to the lab and you're expected to do maybe 5 or 6 tests for the patient. At the end of the day, there was error, something one was not done. You won't start going and be documenting, be writing on conformance, be doing root cause analysis, and be implementing corrective action, preventive actions at that period of time. First, you need to take an action to immediately address. So that action is known as what? Immediate actions. what you do. Then after that, you perform a root cause analysis. Root cause analysis will help you to identify the real challenge, to go down the route to identify what are the issues. Because the success of your root cause analysis is what defines the effectiveness of your corrective action. If your root cause analysis is not properly done, then your corrective actions will be likely not going to be effective. Because they say a problem knows the problem was
Absent.
have stopped. So you need to find dig down to the root cause. Then when you get the root cause, then you need to do what? Put a corrective action. Then after you check for the effectiveness of the corrective action that has been implemented, then you document all the non-conformity activities that has happened from identification to everything and the rest. So these are the components of or the elements of the non-conformity management. So I'll try to explain this as we go today. Please ensure that your mic is muted. If you can hear me loud and clear, please type on the comment section that you can hear me loud and clear. Okay, and these I've explained the types of incident and non-conform. We said purpose, review the lot of non-conformities that you could have within your lab. So what are the common laboratory non-conformities? Patient or sample ID errors, lost sample, sample delayed on transit, contaminated sample, wrong test performing inconsistent with the rating procedure, when you have errors in your proficiency testing, false negative, false positive, late report, no action on out of range control. So when the control is out of range, you don't take any action. You still go ahead to release the patient result. Missing reports, complaints, etc. and etc. All these are common non-conformers we normally have within the lab, laboratory accident, etc. Okay, you said you can hear me loud and clear. Okay. Thank you. Thank you. Thank you. Thank you. All these are common. Please ensure you mute your mic, please. All these are common laboratory non-conformity and etc. There are a lot of non-conformity that will happen within the lab system, within your process, from the pre-analytical to the post-analytical, that cut across all the processes within the, the lab. Okay. Common causes of non-conformance. Or some of the common causes of non-conformance is quality control, EQ not perform, equipment not properly maintained, individual responsibility unclear, when the test kits are not properly stored, transcription errors, checks not done, training not done, competency not done, no written procedures, or procedures are written and procedures are not followed. All these and many more can lead to what? Non-conformity within the lab. So whatever that will lead, please, you're expected to mute your mic, please.
Please, can you throw more light on this transcription error checks not done? Hello, Doc.
Okay, so listen to me. So when we talk about this transcription error, there could be a lot of errors within the lab system. that in such a way that, let's say you have an automated system, and that automated system uh, for an LIS, for example, and your result is transmitted from the equipment to the LIS to the patient folder, to the patient file. Now, there could be a transcription error, a transmission error. That's transmission error. So that error could be a value, could be not the real error, it could be as a result of network failure, whatever it is. So when that error is not checked and the result goes out, or the result is signed, or the result is filed, such an error is known as transmission error. Now, I want to talk about transcription error. Such errors happen manually. Let's say, for example, a test is properly done, but during the process of putting it on the manual result or typing it, you put something different. That is transcription error. The test was properly done, but in the process of reporting it, something else was reported. Let's say, for example, you have 31.4. At the end of the day, the person didn't even see the point and now type 31, 313 or 314. That is an example of what? Transcription error. So those errors could happen within the facility. Please mute your mic. If you have any question, please type it on the comment section, or at the end of the class, you can ask your question. I don't want to mute everyone. Please mute your mic and as we continue. I hope that is clear. Thank you. So now when we talk about non-conformity management processes, now this I've explained earlier, policies, you need to have policies on it. So the policies in the organization tells you what the organization stands for, what's the organization point, what does the organization do when it comes to what non-conformity. That's the policy. It must be stated and must be documented in your policy document on non-conformity. You should have procedures, you should have also forms, then the record of the NCs, then you should be able to investigate the cause, then provide information as all needed, take appropriate corrective actions, then monitor for recurring problem, and provide information as it's needed as long as you go. Okay. Okay, somebody is asking, how can transcription error be detected during an audit? If you're an auditor, you know how to detect it. So as an auditee, if there's a transcription error, so let's say, for example, during a vertical audit, somebody can decide to pick a particular requisition. And when a particular requisition is picked, now doing a vertical audit, there's what we call vertical assessment in an audit. Such can be found by the time the auditor check what was the original result, maybe from the system, and what was transmitted. He or she can detect what the error that occurred within that process. Sometimes the error can be picked, the error may not be picked, but it's expected that before any result is verified, to avoid this, the person who verify the result must ensure that it has an entire view of the whole processes, or to a large extent, and look at it between what is reported and what was actually done. So that's the same is for auditors. When you come for auditors training, you know how to do a vertical audit. Now, however, there's also a part of it that we talk about audit and assessment in the 12 quality system essentials. Now, when we look at this, NC can occur in any of the testing phase. We have said that from the pre-analytical to the analytical to the post-analytical, from the pre-examination to the examination to the post-examination, error can occur at any point. Specimen collection, error can happen. In sampling, error can happen. During testing, error can happen. During reporting, etc. We could have a non-conformance across any part of the lab. But in the lab, from research, most of the over 75% of the errors that happen within the lab happen within the pre-analytical phase. And that's why it is expected that every of the processes within the lab is put into control. And that's why we have process control, quality assurance, quality monitoring, to ensure that the quality of the input determines what the quality of the output. So if the pre-analytical is led for some less level of professionalism or less supervision, there's a high tendency that errors are going to what emanate from that. And maybe, for example, you as a scientist within the analytical space, you don't care whatever that happens in pre-analytical, anybody can collect the sample, whether the person is trained, whether the person understands what is being done, whether the hospital that is bringing the sample or the lab that is bringing the sample, you just collect sample. All you think your job is to do is to just analyze. If the quality of the sample that is being brought to the analytical stage is not of high quality, definitely the analytical stage is definitely going to be compromised. Why? Because of the quality of input that comes in there. So it is for everyone also. So now one of the things you need to do, just look within yourself, right? What are the least different occurrence in different phases of testing? So in pre-analytical, what are the errors? What are the occurrence that we can have? What are the occurrence we can have within the examination phase? And what occurrence can we have during the post-analytical phase? So in your own, where you are seated, you can take your pen, just list them in your own way. Just you do this for the next 2 minutes, or okay, let's say 3 minutes, one for the pre-analytical, one for the analytical, and one for the post-analytical. What are the errors? What are the occurrences? Or what are the non-conformity that can happen at the pre-analytical stage, at the analytical stage, and the post-analytical stage? So you have 3 minutes to jot this down in your notebook.
Wow.
Okay, I think 1 more minute. Okay, so we continue. Having done that exercise, look at what you have written, and whatever you have written there, just have I explained, errors can happen within any phase of the laboratory processes. Now let's look at the pre-analytical aspect. So for the pre-analytical, you could have wrong sample collection or wrong sample collected, mislabeled or unlabeled sample. You can have samples stored in inappropriate um, storage or containers before testing, sample transported in inappropriate medium, reagent or test kits damaged by improper storage, and etc. All these are some of the common things within the pre-analytical stage. Now, for the analytical, example of NC within the analytical, you could have established a algorithm not followed. there's an algorithm for a particular testing, but yet during the process of testing, that algorithm is not followed, thereby generating what a wrong result. Incorrect timing of test. Let's say a test is supposed to be timed for 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 20 minutes to be read, while you are coming to read the result at 30 minutes, or maybe because you were busy, or when the timer was ringing you didn't hear. All those incorrect timing of tests, or even less, can cause what non-conformance. Result reported when control result is out of range, or your control is failed, is not within range, but yet you still went ahead to report it. Let's say improper dilution and pipetting of samples or reagents. There are some of us that don't even know how to pipette. We need to be trained on have a good competency on pipetting. Like when you hold a pipette in angle 90, it's different from when you hold a pipette at angle 45. Reagents stored inappropriately or used after expiration date, either on-board expiration date or manufacturer expiration date. All this can cause what? Non-conformity. There are some EQA programs that fail as a result of what? Expiration date, or maybe the volume of the sample, the volume of the reagent is low, thereby giving some kind of result that is not what? Of quality. So some of them in post-analytical could include transcription error in reporting, report in illegible. Let's say, for example, you're writing, some people when they're writing 7 can look like T. Report sent to the wrong person, or wrong location, wrong customer, wrong client, wrong patient, or report not even sent. The result is ready, but there it's at your confines, it's at your table, and the result has not get to the end user. Remember that the product of the lab is what the result. So they come, they give you their money, their samples. All you owe them is what? That result. So if it is done and it's within the lab, and yet that result or that report is not getting to the patient or to the end user, it's as good as the job is not done. Now, some of the consequences of non-conformity. Now, it's include inadequate or improper patient care. When there is no conformity that is not handled, it can cause inadequacy, can cause poor healthcare delivery, it can cause inappropriate public health actions, it can cause waste of resources, a whole lot of things, sometimes with testing, sometimes wrong diagnosis, wrong patient management, etc. It can help in all the table of communicable disease, outbreaks, and etc. It can also lead to death. So there are a lot of many implications, many consequences when it comes to what non-conformities. And that's the reason why we need to put in a system that can help to what dictate what non-conformance, and be able to manage our non-conformity to be able to deliver high quality result, efficient and effective what healthcare system. So what are the tools for detecting non-conformance? How can we detect non-conformance? Now, one of the tools is screening audit. So whether internal audit or external audit, we can use that to detect what a non-conformance. A feedback or a complaint is also a way to detect what non-conformity. Risk assessment are one of the key emphasis on the ISO 15189 2022 is risk assessment. Talks about risk assessment, which is taking almost the place of preventive action. So before there is an occurrence, we want to identify it. Anything that has the potential of causing risk, and classify the risk and manage it. So if you look at the new ISO 15189 2022, there are more emphasis on what? Risk assessment, risk management. So if you are here, you you work within the lab, whether you're a doctor, pathologist, scientist, technician, and you don't have an understanding of the ISO 15189 2022. It's expected that you do, because that is the standard requirement for competence, for medical laboratory competency. So if you don't understand that requirement and you are not competent in it, definitely you don't you will not be able to what? Align yourself with the standard. So it's advisable that you have one of the ISO 15189 2022 document. It's advisable you read them through. It's advisable you involve yourself in implementing it. And it's also advisable that you do trainings on ISO 15189. So all this knowledge on your basic quality management system that you have will help you to be able to have a better understanding of the ISO 15189 and able to implement the standard. So when you're talking about non-conformance, you know where it is, what is the requirement, what does the standard says about what non-conformance, and which clauses is being addressed, and how can you address it. All these things has to do with implementation. You can also detect non-conformance through EQA, through your standard quality assessment. So remember that the standard quality assessment tests your entire process from the pre-analytical to the post-analytical. There are two reviews, two quality indicators. You can use all these tools to be able to detect what non-conformity. If you have a question, you can type it on the comment section, or you note your questions, and after the class, I'm going to take your questions. Now, non-conformance management process. What are the processes of NC management? I've said it earlier. First, you have to identify the NC clearly. Number two, you have to take immediate action to mitigate the effect of that non-conformance. Number three, you have to classify the non-conformance. Or is it major non-conformance or what a minor non-conformance? I've explained what is a major non-conformance. I've explained what is a minor non-conformance. Number four, you have to perform an ROCA, what we known as root cause analysis. There are different tools for doing root cause analysis. We're going to explain one or two, and you're also going to learn on that. One of the most popular ones are the 5 whys, where you ask 5 whys and drill down to the real root cause, to the cause of that non-conformity. Next, we have evaluate the need for the corrective action using the data that is collected. So you have to put the corrective actions, then you have to implement the corrective actions. You have to record the result of the corrective action, then you have to review the effectiveness of a corrective action. So when a corrective action is implemented, if it addresses the issue, there should not be what reoccurrence if it's effective. So that's one way to know what how effective that corrective action is. Then if it's not effective, then also maybe your root cause analysis was not properly done. So thereby giving a corrective action that does not actually target the root cause or does not address the root cause, thereby making the reoccurrence, making the non-conformity to what to reoccur. So when we talk about immediate actions, corrective actions and preventive actions, let's say for example, the immediate action helps you to put the fire out at that time, but that will not stop the fire from happening. Corrective action will remove the cause of the fire to avoid what reoccurrence. Preventive actions, which is more what we do in risk assessment, is to stop the fire from happening at all. Before it happens, you have stopped it. So stop the fire from happening in the first place. That is preventive actions. Immediate action is to put out the fire. I'm judging that. Then corrective action is to remove the cause of the fire to avoid what reoccurrence. While preventive action is to stop the fire from happening even at the first space. What are the types of action? I've explained this. Immediate action, corrective actions, and preventive actions. So immediate actions is to limit the extent to the non-conformity, whether the root cause is known or not. What you need to do. Let's say, for example, somebody comes to your facility and maybe he sat on a particular chair and the chair just broke down and the person fall down. You start doing corrective actions and start doing root cause analysis, start asking questions. You pick her up or pick the person up. You give her a check and ensure that she's fine. That is immediate action to limit or to reduce the extent of the non-conformity, to mitigate it. Why corrective action here is the action taken to remove the root cause of that problem. You can say, okay, for that chair, all our chair will need to be assessed. All the bad chairs are replaced in the facility, and all the chair that is more than 2 years will be replaced. That is a corrective action. The preventive action is the proactive process of identifying the non-conformity and taking action to prevent their occurrence. Let's say, for example, you go there and say, this chair, with the way it's going, this chair may likely going to break soon. You have identified what? You have done a risk on it. They have identified it. Then take a proactive action. At the end of the day, there will not be occurrence because what? Of the preventive action. Am I communicating? Okay, if you can hear me loud and clear, please type on the comment section that you can hear me. Okay, thank you. Thank you for the response. Thank you for the feedback. Thank you for the response. Thank you for the feedback. So we continue. So evaluation of a non-conformity. So when you want to evaluate a non-conformity, one of the first thing you do is to gather information. So you gather the information, just like for example now, like in the context of Nigeria setting, when you have an issue, uh, maybe you go to the police station, they will ask you to write a statement. So the statement helps them to gather what information. So the information gathering is not what we call as incident report, also known as what incident report, whereby you are going to gather the information and document the information in a chronological manner. In other words, in the way it happens. Significant evaluation. Then next you do what is the impact analysis. What's the impact on of this non-conforming? You analyze it. Then four, you have to do a root cause analysis. They won't talk about root cause analysis. This is structural investigation that focuses on identifying the underlying true cause. Non-conformance, you use the root cause analysis tool to identify the root cause. A combination of one or two root cause analysis tool can help you identify the real root cause. Now, I'm going to explain this as I can, as much as I can. Now, we'll talk about the example of root cause analysis too. We have different. We have what we call Pareto analysis. We have what we call histogram. We have what you call fishbone. We have what we call tree diagram. We have what we call flow chart. Then we have uh, brainstorming. Please, I'll explain some. We have the Pareto. We have this scatter diagram. We have the histogram, and we have what the 5 whys approach. So please follow me as I try to explain some of them. You can use any of these both by you. You can use a combination of one or two to also do your root cause analysis. So for brainstorming, you formulate a question. You are brainstorming, just like the way the word means brainstorming. Request response for possible cause from the target group, from the people who are involved. Then the group response received. That group response that is received, use a vote or what we call the parental chart to select the main cause. Let's say if 10 people are brainstorming and this one talk, what do you think will the cause of this? Okay, this one said, this one said, this one said, this one said, this one said. At the end of the day, you make decision based on expert opinion of the cause of what the non-conformers. So those ones that are occurring are based on expert knowledge. You can pick the real root cause during brainstorming. So that's how you use the brainstorming approach. Now for the parental chart, identify the possible cause using the brainstorming. You have brainstorm. Usually tally chart to distribute the cost. Now there are different courses you could just check at the end of the day. Determine the frequency and the percentage of the cumulative frequency. Let's say for example, we were talking about this is the cost. How was the occurrence? What's the frequency of that occurrence based on the brainstorming? If there is 5 people that are saying, okay, this is the cost. Now 2 people are saying something, and then probability that 5 out of the whole, because it has the highest occurrence, as you can see here, can be the real root cause. and 80% is giving us what? Situations. Now, we also have the fishbone analysis. Know this fish, normal fish. So that's if you have seen a fishbone and in fact the cause of the problem, you have
Doctor, please,
brainstorm.
the
Please,
20% and the 80%, sorry. Can you say something about the 20% and 80% rule? Sorry.
okay. I said if you have a question, type it on the comment section or you note it after the class. Now I will explain. Now, 20% of the actions gives 80% of the results. It is the parental principles that 20% of the actions give 80% of the result. Now, so make a decision based on the parental rules. Let's say, for example, 20% of the control and 80% in a given situation. So for most of the cases, now you can see that if you look at this diagram, the 80% there and the 20% on that cumulative frequency. So most of the period, those 20% controls give 80% of the results that is needed. So if you can, if you understand what is called parental principle, it said that 81 of it is that 80% or 20% of our effort is what give 80% of our results. So the control you have, the 20% control you have in a particular process, are you getting me? Can lead to 80% of the outcome. Okay, don't worry, I will explain better if you don't understand it this way, using our another example when I'm talking about the 5 why analysis. Now, we'll talk about the fishbone analysis too. It's the same thing. You gather the information. Let's say, for example, maybe somebody could say inspection, somebody say material, somebody say method. You streamline it. Now you have different root cause based on the fishbone analysis, based on the brainstorming. Now you streamline it to the point that you get the real problem, the real cause of that. So let's say for example, something happened and it could be equipment issue, it could be personnel issue, it could be method. But at the end of the day, these are what you get from different brainstorming. Now, there's a specific problem or characteristic that are considered to be the head of it. So potential causes are considered the bone structure. Illustrate the possible relationship between some identified effect and the cause influencing it. So there are some of the causes of that non-conformity that are influenced by others. So the real cause that are influenced by others now is what is known as what? The problem statement. Now, I will explain this using the 5 why analysis. Let's say, for example, before that, let's say the non-conformance is okay, personnel. Now, the person is personnel issue. But before the personnel is having issues, sometimes it could be a training problem for the personnel. Sometimes it can even be stress and fatigue. So stress and fatigue now can cause a personnel to have an error. So now, though you have identified the personnel, but the real cause, the brain problem can be stress, which is making the personnel. Let's, for example, a work that 5 scientists are supposed to do, 2 scientists is doing them. That could be a stress. Where it is the scientist who made the problem, but in a literally, you may think it's a personnel issue, but it's actually more of a system issue. Why? Because there's no adequate staffing. And that has resulted the patient, that may have resulted the personnel to stress. Sometimes it can even be turnover, high turnover. People are leaving, people are jackpotting, people are leaving the organization. At the end of the day, it has effect on the personnel, and the personnel has a direct effect on what? On the system, and at the end of the having those non-conformity. So we look at this is almost the same thing. Flow chart, step 1, step 2. Histogram. The histogram still talked about the frequency, reflect the relative frequency occurrence. Let's 5 if it has occurred in the 5 because using some because each child is the root cause with using open your mind, open your ears and listen to doing maybe a blood work. So can you see my slide? Okay. So the transfusion error, transfusion reaction or transfusion problem within. Now the first question is that why was there a transfusion reaction? Now the first one. So the answer that I was giving was found was that there was a wrong blood group given. Wrong blood group that was given, let's say from the lab, that cause was the transfusion reaction. So if you leave your answer as wrong blood giving and you now put a corrective action based on wrong blood that was given, it may not be effective because that may not be the root cause of it. So the next question is that now you have gotten that, oh, the wrong blood was given to the clinic. That is why they have transfusion reaction. The next question is that why was wrong blood given? So your answer, the answer determines what the next question. So why was wrong blood given? Oh, sample was mislabeled. The next question is that, so if you now deal with, oh, cross matching was mislabeled, that may not give you the corrective action may not be effective. So you drill down again and say, why was the cross match sample mislabeled? Or sample labeled at bedside. So that means, why was the sample, or the nurse did not follow the protocol, or the house officer did not follow the house officer not follow the protocol? The nurse was not, or the personnel was not adequately trained. So the issue, you see now, how many whys do we have there? 1, 2, 3, 4, 5. So now we have drilled it down that the reason why we had a transfusion reaction was not because the wrong blood was given, though it was part of it, but its real root cause is what? Lack of training of the staffs who collected the sample. So it means that if they have been trained properly, they will follow the protocol. If they follow the protocol, sample will be labeled, because sample needs to be labeled. You can't carry the sample to the lab without being labeled. Then the cross-match sample would have not been mislabeled. The wrong blood sample would have not been given. So the upper up superficially, you're just seeing a transfusion reaction. You are seeing a wrong blood giving, but that is not the real root cause. The real root cause from this drilling could be the nurse not adequately trained. Now, let me take another example. Please listen to me. This is not on the slide. A patient came to the facility and the result was not ready. Are you getting me? And the result was not ready. Now, the first why? Why was the result not ready? Oh, the scientists did not run. Did the scientists not run the test? The reagent, there was stock out. Stock out. Oh, the supplier did not supply the reagent. Why did the supplier not supply the reagent? The next why answer could be, oh, uh, uh, the next why would be the supplier did not supply the reagent because the procurement team now did not give requisition to the supplier. Now the question: why did the procurement team not give the requisition to the suppliers to supply? Oh, they have been owing them, and the supplier is no longer receiving any uh, request from the lab. Now, why why did that happen? Oh, there is no fund within the organization. Why is there no fund? At the end of the day, oh, there was no cash flow. People who owe the lab or have not paid. You see that? So the real problem why the uh, sample was not done, the test was not ready, was not the scientific problem. Not even the procurement. Say what? It's a cash flow issue. Putting a corrective action. Why was the scientists? Why did they not run the test? Would they run the test when they don't have the reagent? To get to the real root cause. This is the way to use the 5 whys to get to the real root cause. Is that well understood? So you see here now that the real root cause is inadequate training of the new nurses on what? Sample what? Labeling. So now your homework is identify and resolve and document the non-conformity. Put the immediate corrective action. Look for the root cause. You could do the 5 why and put the corrective actions. So uh, that is your assignment for this module. Please take note of that. Now, look at this. It's like a group work. What do you think? Okay, applicable here. So this is first scenario. Please look at them. During an internal audit, it was found that a test report within the unique lab was reported on so and so date, and the sample was received on the 28th of, on 28th of May 2021, and then on 11th of June 2021. The court 2021 specified that the results are to be reported within 8 working days from the day of receiving of the sample. Now, this is a non-conformance that has happened. So you put a corrective action, you manage it. So here now talking about delay of reporting. So the sample was collected on the 28th of May. Result was reported on the 11th of what? June. And they are specified that it should be within 8 working days from the date of receiving. So this is one scenario. Two scenario, maybe after arriving at work at 8 a.m., you already notice a long outpatient queue. Now by 8:30 a.m., the queue is even longer. Both patients already received their first batch of sample specimen ready for analysis. We discovered that the person assigned to that workbench they are reading newspaper, morning newspaper, or they are listening to Embelembe. or they are putting earpiece in the ear, listening to something. So this kind of non-conformity, how do you manage it? These are different case scenario which you can pick from and analyze and give an immediate corrective action, immediate action, find cost analysis, give a corrective action, and see it if the corrective action is effective. This is another scenario. A phlebotomist report that he stuck himself with a contaminated needle during blood collection. Earlier in the month, during his phlebotomy competency assessment, you notice that he routinely recap used needle. After providing feedback during the assessment, you notice that the laboratory policy does not explicitly state that recapping of needle is prohibited. You decided not to document this finding because it did not uh, abort any of the of the standard operating procedure during the assessment of it. But now the person has have a needle prick. There's a non-conformity now that has happened. So you look at it. What is the immediate action that should be taken at this point? What is the root cause analysis? Do a root cause analysis. Do a corrective action. Now, also case 4 2 and 5. So I will share this case on our platform. So you have to pick one of them and work on it. Now, let's say for example now, group 2 now talks about group 2 scenario now. Talk about people after arriving at work 8 a.m. You already notice that there's a long queue and 8:30 and they pick batch of sample, get to the lab. At the end of the day, you see the people who are supposed to be even running the test are busy reading newspaper. So what do you think will be the immediate corrective action there? And all the rest. So these are the way you look at these non-conformers. First, you have identified the non-conformers that has happened. Yeah. Then secondly, you put an immediate action. Then you do a root cause analysis, then put a corrective action, and you monitor to see if that corrective action is being what effective. So established method for identifying and managing non-conformers and preventing them from occurring again. So how do you do this? First, I said you have to look at the non-conformance component. First is to have a policy on it, have a procedure, have a process, have forms for managing what non-conformity. Then identify the problem earlier and take immediate and corrective actions. Then seek opportunity to identify potential NCs, thus preventing non-conformers that could occur. Maintain a good record of all your NCs, the investigations, and the actions that is taken. Now, non-conformance management is an integral component of the laboratory quality management system. The difference between a quality managed lab and those with no system in place is that the quality laboratory detects non-conformity, investigates it, and take action. Why a non-quality oriented lab, anything can go in. There's no identification, no corrective action. Things happen. Way like it. Sorry, it will not happen again, and it happens. If an NC can impact patient care, the laboratory should inform the caregiver promptly, or the organization, or the wherever that sample is coming from, wherever that patient is coming from. This is very, very important. Now, I will share one document with us before I shut this and ask for questions. Please just hold on. So, can you see this? Yes, you can see it. You can type on the comment section. Yes, I can see it. So, this is an example of a non-conformity, non-conformance form. So this is the name of the lab, the department, the area that can be audited. You're using an audit. Then the observation, which is the non-conformance. The classification, is it major or minor? You could put it there. What is the clauses? Maybe the auditor can put the clauses there for you. Then I think something is not here. There should be a space for the immediate corrective action. Yes, look at it, is there. Immediate corrective action. So the immediate corrective action should come first before the before the root cause analysis. So you state the corrective action, immediate corrective actions that 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 is taken. Then you do a root cause analysis, they put the corrective action there, and you sign. So this is an example of a form for managing what's not conform. It doesn't have to be this. You can design your own, or the lab can design your in such a way, but there are key components which has to do with what the observation, which is the non-conformity, the immediate corrective action, the root cause analysis, and the corrective action that is being put. This has to be documented and signed and filed, and the record has to be there. Any lab that suit non-conformity, or you go to the lab and say, you have the non-conform patient complaint. Say, no, we don't have. It just shows you that you are actually sweeping down those actions under. And non-conformity is not a punitive measure. It does not affect it should not affect your it should not be used as a punitive measure for staff. It is used basically to identify non-conformant errors and be able to improve them, take actions to prevent it, so that we can have a good quality, we can have standard processes, we can also have we can also be able to meet our patient or the end user's need. Please hold on 1 minute.